Hi, my name is Edna Maldonado. I have been with the AUA for 9 years. I am with the Practice Management Network. I oversee the coding hotline. And prior to that, I really got my experience in working for a urology practice in Florida. And I actually started as the receptionist there, and I was in that practice for 20 years. When I left that practice, I was actually the office manager. I had a great physician that was willing to teach, and I was willing to learn. So my expertise is in urology. That's my field. That's what I like, and that's where my education is. And I just finished doing a talk on proper surgical documentation in urology for the Practice Management Conference. It is important because if a physician does not document, let's say, the procedures that they do, and it's not documented, basically what we do, if it's not documented, then it was not done. So we want to make sure that they document everything that they did so that way we can capture the entire case, the entire procedure that was done, so that way we can be able to bill to the highest level and bill for all the procedures that were completed. This topic was very important for the practice managers and conference for us to do it this year because we're seeing more and more lack of information in the documentation of the surgical procedure. So I think that if we inform our doctors and explain to them, listen, if you were to document your medical necessity and you document correctly, then we will have clean claims and it won't affect their accounts receivable, their cash flow. So documentation is extremely important. I was able to express to them that according to their documentation, let's say, for example, if a patient had a surgical procedure done, let's say within a week or two ago, and that patient is within global, then if the doctor was to properly document patient so-and-so had a surgical procedure done on such and such date, that actually helps their staff in appending a proper modifier. So that way we won't lose out on that surgical procedure. And I always let them know that I am available at the Practice Management Network, at the coding hotline. I also do these customized coding seminars that I can help the practice if they're having any issues with coding and billing. And I also do the customized coding seminars, and we educate on, the new codes that came out as I did on the previous podcast. So, and one of the questions that came up on the talk is on Modifier 25, and they wanted to know if it's okay to bill a Modifier 25 with an E&M service and do a cystoscopy in the office. And that's a good question because Modifier 25 is actually in the radar for the Office of Inspector General. They're looking at proper use of this modifier. They want to make sure that the physician documents the medical necessity as to why they're using Modifier 25, because there's certain times that a physician or a practice may feel that it's okay to do a diagnostic procedure during the same day as an E&M office visit, but we're seeing that more and more, not only Medicare, but other private payers are not covering the E&M service with a 25 modifier on a diagnostic procedure that is being done on the same day. Another question was on billing certain CPT codes for surgical procedure. And normally I really need to read the operative report to see what is it that was really done. But I also have a system that I can double check for bundling matrix, and it tells me if these particular CPT codes are bundled or not. So I'll be able to help them out with that. I always tell them to please make sure that they have the latest information on their let's say their resources that they're getting for urology coding, whether it is for their coders, whether it is that they need to look for fee schedule for the physicians to know the allowables for these procedure codes that they're doing. There's so much information that we can provide and we can help practices. I can say that, let's say we do not follow these guidelines and these proper documentation and medical necessity. We are risking physicians getting denied for their claims. We're also risking, in some situations, fraud, because if we're bundling, let's say, or double dipping what they call on two surgical procedures that are already bundled, and you know they are bundled, and you're trying to use a modifier to unbundle them, that's considered illegal and it's fraud. But so you have the good that comes out of your proper documentation, which it goes into a clean claim and you get paid correctly. And then you have the risk of not performing the proper documentation. You're missing out on medical necessity, and you may not be appending or documenting everything that was done within the procedure. So then you have improper coding, improper billing, and then you risk denials and you have to appeal the claims. So it's always best to know and have a good knowledge of what is needed, what is included in a code, how other procedures that are bundled together, proper use of modifiers, because with modifiers, that is how we communicate with insurance companies as to what was done, because there are different levels of modifiers. So you have modifiers that are informational modifiers, and then you have modifiers that may increase your payment. So in those situations, it's always good to always maintain and stay up to date with all the information that is provided by the AUA or whatever source, these practices are searching for. So again, if anyone needs to reach me, you can reach me through the coding hotline via email, codinghotline@auanet.org. Or you may call 1-866-746-4282, and that would be option 3, and that is to reach me at the coding hotline.
Thank you for listening to the AUA Inside Tract podcast, an official podcast of the American Urological Association. For more information, please visit auanet.org.